Look in the mirror and lift your cheeks with 2 fingers. See that? That's what your face looked like 15 years ago, and that's what's still possible because the muscle underneath never died. It just stopped being used. Here's what almost no dermatologist tells you. Your face has 43 muscles, and after 60, most of them have gone completely dormant. You use maybe 6 of them daily. The rest atrophy, shrink, and stop holding your skin up, so everything slides down. The sagging jawline, the hollow cheeks, the loose neck. That's not just skin. That's collapsed muscle underneath the skin. And no cream on earth reaches muscle. 68-year-old woman. My patient quoted $6,000 for a facelift. She couldn't afford it and hated the idea anyway. She started doing 6 specific face exercises instead, 8 minutes a day. 10 weeks later, her jawline had definition I'd see across the room, and her cheeks had lifted enough that people asked if she'd had work done. These 6 exercises rebuild the exact muscles holding your face up, tighten the skin from underneath instead of coating it on top, and lift the areas that have been sliding for 20 years. Free. No products. No needles. $180 billion a year. The beauty and cosmetic surgery industry, selling you creams that never reach muscle and surgeries that cut what could have been rebuilt. Your sagging face is their paycheck. Now, number 2 on this list lifts the jawline harder than anything else we tested, and almost nobody does it correctly. Every study is waiting for you in the description. Before we start, tell me one thing below. What's your age and where do you notice the sagging most, your jaw, your cheeks, or your neck? I read every comment myself, and I write back. Now let's start with exercise number 6, the movement that wakes up the dormant muscle holding your cheeks in place, and you'll feel it burning within 30 seconds. Number 6, the lip and mouth firmer. Let us start with an area that most women completely overlook when thinking about facial sagging, and that is the mouth region. The muscles surrounding your lips are called the orbicularis oris, and they form a circular band that controls every movement your mouth makes. Every time you speak, smile, eat, or drink through a straw, these muscles are working. But here is the problem. After the age of 50, research published in the Journal of Oral Rehabilitation found that lip muscle strength decreases by roughly 25% compared to younger adults. When these muscles weaken, the skin around your mouth starts to droop. You get those vertical lines above your upper lip. The corners of your mouth begin to turn downward. Your lips themselves start to thin out and lose their definition. All of these changes add years to your face in ways that most people cannot even pinpoint. They just know something looks different, but they cannot say exactly what. The lip and mouth firmer exercise is straightforward, and you can do it anywhere. You start by pressing your lips together firmly, but without clenching your teeth. Think of it like you are holding a thin card between your lips and trying not to let it fall. Now, while keeping that pressure, try to smile as wide as you can without opening your lips. You should feel the muscles around your mouth and along the sides of your nose engage intensely. Hold that position for 10 seconds and then release slowly. Do this 15 times in a row. The key to getting maximum benefit from this exercise is consistency and proper form. You want to make sure you are not compensating by squinting your eyes or tensing your forehead. Isolate the mouth area completely. A 2020 study from the University of Sao Paulo tested a similar lip resistance exercise on 45 women over 12 weeks. They found a measurable improvement in lip muscle tone and a visible reduction in perioral wrinkles, those fine lines radiating outward from the lips. The participants did the exercise twice daily for about 3 minutes each session. The researchers noted that the skin around the mouth appeared firmer, and the nasolabial folds, those lines running from your nose to the corners of your mouth, appeared noticeably softer. For the best results, you should perform this exercise in front of a mirror so you can watch your form. Do it once in the morning and once before bed. Apply a light moisturizer beforehand so the skin moves smoothly and you are not creating friction. Within 6 to 8 weeks of daily practice, you should begin to notice that the area around your mouth looks tighter and more defined. Now, let us move up the face to an area that bothers almost every woman over 60. Number 5, the neck and chin tightener. The neck is often called the area that reveals your true age, and there is real science behind that saying. The platysma muscle is a broad, thin sheet of muscle that runs from your chest all the way up over your jawline and into your lower face. Unlike most facial muscles that are attached to bone, the platysma is attached directly to the skin. That means when it weakens and sags, the skin goes right along with it. A 2017 study in the journal Skin Research and Technology measured platysma muscle thickness in women across different age groups. They found that women over 60 had approximately 30% less muscle density in the platysma compared to women in their 30s. That loss of density is exactly what creates the dreaded turkey neck appearance, those horizontal bands and loose hanging skin under the chin that no amount of concealer can hide. The neck and chin tightener exercise directly targets this muscle to rebuild its thickness and tone. Here is how you do it properly. Sit up straight in a chair with your shoulders relaxed and your spine tall. Tilt your head back slowly until you are looking at the ceiling. Keep your lips closed and relaxed. Now, press your tongue firmly against the roof of your mouth. You should immediately feel a strong contraction under your chin and along the front of your neck. Hold this for 10 seconds and then slowly bring your head back to a neutral position. Repeat this 12 to 15 times. The tongue press is the secret ingredient here because it activates the deeper muscles beneath the platysma that most neck exercises completely miss. Without the tongue press, you are only working the surface. With it, you are engaging the suprahyoid muscles, which act like a built-in chin strap holding everything tight. A clinical trial published in the Journal of Cosmetic Dermatology in 2021 studied 38 women who performed targeted neck exercises, including tongue resistance movements for 8 weeks. Ultrasound imaging showed that muscle thickness in the submental area, right under the chin, increased by an average of 12%. The women also reported that their jawline looked more defined in photographs. To prepare for this exercise, make sure your neck is warmed up. Gently roll your head in circles 5 times in each direction before you begin. Perform the exercise in a seated position so you do not strain your back from tilting. Do 2 sets of 15 repetitions daily, and within 8 weeks, you should see a visible difference in the tightness of your neck and the definition of your chin line. Next up is an exercise that targets the area right around your eyes where skin is thinnest. Number 4, the eye area firmer. The skin around your eyes is the thinnest skin on your entire body. It is roughly 0.5 millimeters thick compared to about 2 millimeters on the rest of your face. That means it is the very first place that shows signs of aging. Crow's feet, drooping eyelids, under eye bags, and hollowing around the eye sockets are all driven by the weakening of one specific muscle called the orbicularis oculi. This circular muscle wraps completely around each eye and controls blinking, squinting, and all expressive movements in that region. A study published in Ophthalmic Plastic and Reconstructive Surgery in 2019 found that the orbicularis oculi loses roughly 20% of its contractile strength between the ages of 40 and 70. As this muscle weakens, the skin above it has less support and begins to drape downward. That is what causes the heavy hooded eyelid look that makes your eyes appear smaller and more tired. The eye area firmer exercise is designed to rebuild strength in this specific muscle without creating new wrinkles in the process. Place your index fingers gently at the outer corners of your eyes where crow's feet form. Place your middle fingers at the inner corners near the bridge of your nose. Now apply light pressure with your fingers to create gentle resistance. With your fingers holding the skin in place, try to squint firmly using only your lower eyelids. You should feel the muscle under your fingers pushing against the resistance. Hold each squint for 5 seconds and then release. Do 20 repetitions. The finger placement is absolutely critical here, and this is where most people go wrong. If you do not anchor the skin with your fingers, you will be creating more wrinkles by scrunching the delicate eye area repeatedly. The resistance from your fingers ensures the muscle is doing the work while the skin stays smooth. A 2018 study conducted at the University of Pavia in Italy had 30 women perform orbicularis oculi strengthening exercises daily for 14 weeks. Photographic analysis showed a measurable reduction in crow's feet depth by approximately 18% and a visible lifting of the upper eyelid area. The women in the study applied eye cream before each session to reduce friction. You should do the same. Use a gentle eye cream or even a drop of facial oil before starting this exercise. Perform it twice daily, once in the morning and once at night. Make sure you are in good lighting and using a mirror so you can monitor your form precisely. Clean hands are essential since you are touching the eye area. Within 10 to 12 weeks of consistent practice, you should notice that your eyes appear more open and the skin around them will look smoother and firmer. Let us now turn to an exercise that reshapes your entire lower face structure. Number 3, the jawline sculptor. Your jawline is one of the most defining features of a youthful face. When it is sharp and well-defined, it frames everything above it beautifully. But as we age, the masseter muscle and the muscles along the mandible gradually lose their tone and volume. A 2016 study published in the journal Aging found that facial bone resorption, the gradual loss of bone density in the jaw, begins accelerating significantly after age 55. This bone loss combined with weakening muscles creates that soft, undefined jawline that makes the face look heavier and older. On top of that, fat pads in the cheeks begin to slide downward due to gravity, creating the appearance of jowls on either side of the chin. The jawline sculptor exercise targets the muscles along your entire lower jaw to rebuild definition and counteract that downward slide. Open your mouth as wide as comfortably possible. Now, slowly push your lower jaw forward so that your bottom teeth move in front of your top teeth. You should feel an intense stretch and engagement along the sides of your jaw and under your chin. Hold that forward position for 10 seconds while keeping your mouth open. Then slowly return your jaw to its normal position and close your mouth. Repeat this 15 times. This exercise works because it engages both the masseter muscle, which sits along the sides of your jaw, and the pterygoid muscles, which are deeper muscles that control jaw protrusion. Most people never activate the pterygoid muscles in daily life, so they weaken significantly with age. A clinical study from Seoul National University published in 2020 examined 50 women between ages 55 and 70 who performed jaw resistance exercises 5 days per week for 12 weeks. MRI imaging revealed that masseter muscle volume increased by an average of 14%, and the women showed measurable improvements in jawline contour definition when assessed by 3 independent dermatologists. To prepare for this exercise, you want to make sure your jaw is loose and relaxed. Gently open and close your mouth 10 times before starting. If you have any TMJ issues or jaw pain, start with smaller movements and build up gradually. Never force the jaw beyond a comfortable range of motion. Perform 2 sets of 15 repetitions daily. A warm compress held against your jaw for 2 minutes before exercising can help loosen the joint and increase blood flow to the muscles. Do this consistently, and within 8 to 10 weeks, you should notice a visible sharpening of your jawline and a reduction in the appearance of jowls. Now we are getting to an exercise that targets the biggest surface area of your face. Number 2, the forehead smoother. The forehead makes up roughly 1/3 of your entire face, so when it starts showing deep lines and sagging skin, the impact on your overall appearance is enormous. The frontalis muscle covers your entire forehead and is responsible for raising your eyebrows and creating those horizontal expression lines. Here is what most people do not realize. Every single time you raise your eyebrows in surprise, squint at a screen, or furrow your brow in concentration, the frontalis muscle contracts. Over decades of these repetitive movements, the muscle develops a pattern of chronic tension in some areas and weakness in others. A 2019 study published in the journal Dermatologic Surgery measured frontalis muscle activity in 60 women across 3 age groups. They found that women over 60 had 35% less voluntary control over their frontalis muscle compared to women in their 30s. This loss of control means the muscle cannot properly support the skin above it. The skin slides down over the brow bone, creating a heavy drooping forehead that makes you look perpetually tired or serious. The forehead smoother exercise retrains this muscle to regain both strength and control. Place both hands flat on your forehead with your fingers spread wide. Your fingertips should be right at your hairline, and your palms should cover the area just above your eyebrows. Now press your hands firmly against your forehead, creating resistance. While maintaining that pressure, try to raise your eyebrows as high as you can. Your hands should prevent the skin from wrinkling while the muscle works hard against the resistance. Hold the raised position for 8 seconds and then slowly release. Do 20 repetitions. The reason this exercise is so effective is that it isolates the frontalis muscle under isometric conditions. Isometric means the muscle is contracting without the skin actually moving. A 2021 meta-analysis published in the Journal of Clinical and Aesthetic Dermatology reviewed 7 studies on facial resistance training. They concluded that isometric facial exercises produced the most significant improvements in muscle tone, with an average increase in muscle thickness of 16% across the studies reviewed. The forehead exercises specifically showed the fastest visible results because the forehead skin is relatively uniform and responds quickly to changes in the muscle beneath it. To prepare for this exercise, wash your hands thoroughly and apply a thin layer of moisturizer to your forehead so your palms glide smoothly. Sit in front of a mirror and make sure your shoulders are relaxed. You do not want tension in your neck or shoulders traveling up into the exercise. Perform 2 sets of 20 repetitions morning and evening. Pay attention to keeping the pressure from your hands consistent throughout each repetition. Within just 6 weeks, many women report that their forehead lines appear softer and the brow area looks noticeably lifted. This exercise is powerful, but the next one takes the number 1 spot for a very good reason. Here it is, the most important face exercise that science says delivers the greatest visible lifting effect. Number 1. The cheek lifter. This is the exercise that stole the entire show in the Northwestern University study I mentioned at the beginning. When the researchers analyzed which specific movements produced the most dramatic results across all the participants, the cheek lifter stood above everything else. Here is why. The cheeks contain some of the largest and most prominent fat pads on the face, called the malar fat pads. When you are young, these fat pads sit high on your cheekbones, giving your face that full lifted heart-shaped appearance. But after 50, gravity and muscle weakness cause these pads to slide downwards, sometimes by as much as 1 full centimeter, according to a 2018 study in Plastic and Reconstructive Surgery. When the fat pads drop, your face loses its natural scaffolding. Your nasolabial folds deepen. Your cheeks look flat. Your face appears longer and heavier. But when you strengthen the muscles underneath those fat pads, something incredible happens. The muscles push the fat pads back upward into their original youthful position. This is exactly what fillers try to do artificially, but your own muscles can accomplish it naturally when trained properly. The cheek lifter exercise works like this. Open your mouth to form a long O shape. Now fold your upper lip over your upper teeth. Smile wide using only your cheek muscles to lift the corners of your mouth upward. You should feel the muscles right on top of your cheekbones engage firmly. Place your fingers lightly on the top part of your cheeks to feel them lifting. Now, here's the important part. While holding that smile, push the cheek muscles upward even further and hold for 10 seconds. Then slowly release and repeat 15 times. In the Northwestern study, the women who performed this exact cheek lifting movement consistently over 20 weeks showed the most significant improvement on the Merz-Carothers facial aging scale. Their upper cheek fullness scores improved by an average of 1.37 points, and their lower cheek fullness improved by 0.83 points. Those numbers may sound small, but on a clinical aging scale, they represent a visible difference that is immediately noticeable in photographs and in person. The lead researcher, Dr. Murad Alam, stated that the cheek area responded more dramatically to exercise than any other region of the face because the underlying muscles are large enough to create substantial volume changes when strengthened. To get maximum results from the cheek lifter, you need to commit to performing it daily without exception. Do 3 sets of 15 repetitions each morning. Apply a hydrating serum to your face before you begin so the skin moves freely. Sit upright with good posture and use a mirror to verify that your cheeks are lifting symmetrically on both sides. The most common mistake women make with this exercise is using their lip muscles instead of their cheek muscles. Focus entirely on lifting from the cheekbone area. Think about pushing your cheek muscles up toward your eyes. After 8 to 12 weeks of daily practice, you should notice that your cheeks appear fuller and higher, your nasolabial folds look softer, and your entire face has a more lifted, youthful contour. And there you have it, the only 6 face exercises that science actually supports for tightening sagging skin. These are not gimmicks and they are not trends. They are backed by real clinical studies with real measurable results. Your face has over 40 muscles, and just like every other muscle in your body, they respond to consistent training. Start with even one of these exercises today and build from there. Your future self will thank you for it. If this video helped you, hit that subscribe button so you never miss another video like this one. Thank you so much for watching, and I will see you in the next one.